This is a short PowerPoint about the mucosal atomization device. Just wanted to cover a few more pieces of information. In this you'll also see the protocol and procedures for MAD, and we'll discuss a little bit about how MAD works. The MAD device has actually been utilized for many years, many different medications. It found its way back into pre-hospital at least a decade ago, and has been utilized most recently in the last several years even by lay people to deliver Narcan intranasally for overdoses. MAD device does not require a needle stick, which is good for you. It's less painful for the patient, and you don't have the possibility of getting a dirty needle stick by using an IV. Pretty much everyone has a nose, and as long as the nose is in good shape, you should be able to use it to deliver the medication. And you will find times when you prefer to use MAD over an IV stick. Perhaps you want to deliver the medication more quickly. Narcan is much more forgiving intranasally. You're not going to be waking people up quickly, vomiting and fighting you, usually intranasally. But you will be able to use your own judgment on which is best for each patient. MAD delivers atomized particles to the olfactory mucosa, and they're in direct contact with the brain and cerebrospinal fluid, which provides a direct route for drug delivery. There's somewhere between 55 and 100% bioavailability. Meds don't suffer first-pass metabolism as they would if they were delivered orally. IV medications are 100% bioavailable. Here's a picture of the nose and the olfactory mucosa. The medication goes into the cerebrospinal fluid, giving very rapid brain levels of the medication, very rapidly absorbed and utilized. Bioavailability can be affected by different factors. pH for medications delivered intranasally need to be near physiologic. Molecular size has a lot to do with how available the medication will be, what drug concentration is used, viscosity and lipophilicity, which we'll discuss in just a minute in a little more detail. The mucosal atomizer atomizes medications between 30 to 100 microns in size. That's evidently the perfect size for the medication to be uptaked into the bloodstream and into the cerebrospinal fluid. If the atomizer is pushed too slowly, then the particles will be too big, and the particles won't be able to absorb through the circulatory system. They're going to drip into the throat. Same can be said if it's done just a little bit too rapidly, which is almost impossible to do, frankly, with MAD. But if the particles did become smaller than 30 microns, then they would enter the lungs and there wouldn't be absorption through the circulatory system. Viscosity really has to do with the thickness of a fluid, the resistance to flow in a fluid or a semi-fluid. I have a picture here showing one blue liquid that's more fluid-like than the one on the right, which is thicker. I'm sure that there's a scientific definition for it, but I believe that we're good enough with thin or thick. All right, lipophilicity means lipid-loving. Mucous membranes love lipids. They love fat. They easily and rapidly absorb something that is fat-containing. They're capable of dissolving or being dissolved in or of absorbing lipids. The MAD device should be pushed fast, should have a lot of pressure applied behind it in order to ensure that the drugs are atomized correctly. You guys will be able to practice with these when the training is brought around to your stations, and you'll find really it's very simple to use, and you can tell when you're utilizing it properly by the way it feels and the way the medication is misting. The medication must be high concentration, and we want the lowest volume possible, because the most volume we can use is 1 milliliter per nostril. So the higher the drug concentration, the more medication we would be able to deliver if we needed to. Luckily, our medications are already carried in the concentrations that are appropriate for intranasal administration. Narcan drug concentration right now is 1 milligram per milliliter. Fentanyl is 50 micrograms per milliliter, and your Ativan is 2 milligrams per milliliter. This is just a brochure that is included in the MAD device. I wanted to show you guys a few things on here. First of all, it does have tips to improve success located on it. It also shows the MAD device and a syringe. I circled in red up on the top left a picture of the device that fits on top of the syringe. That's the MAD cone shape there. And then it gives steps on medications, how to remove the medication and aspirate the proper amount. I circled step number 3, and it's enlarged up here on the right because you'll see it says to aspirate the proper volume of medication required to treat the patient, and an extra 0.1 milliliter of the medication should be drawn up to account for dead space in the device. So there's an area in the device after you draw medication, the fluid up. Once you've pressed the syringe all the way, there's going to be a 0.1 milliliter residual in the device. So it really may not matter so much with your larger dosing, but it is definitely going to affect your pediatric dosing, and that's why it's important to draw up that extra 0.1 milliliter. And I'll show you in just a minute how important it will be. So your dosages for Narcan, fentanyl, and Ativan, which are the 3 medications we will be utilizing intranasally right now. Narcan is the same as IV dosing. It's 2 milligrams, which would be 1 milliliter per nostril. In pediatrics, it's 0.1 milligrams per kg up to a dosing of 2 milligrams, which would be a 20 kg patient. After that, you're going to adult dosing. Fentanyl is 2 micrograms per kg, and your Ativan dosing, don't dilute Ativan for intranasal administration. The dosing is 2 milligrams intranasally to a max of 4 milligrams. And then your pediatric dosing is 0.1 milligrams per kg in 2 milligram increments. And your max dosing for pediatrics is 4 milligrams. Of course, you guys know that fentanyl and Ativan, fentanyl's call-in order. Ativan is a call-in after 4 milligrams. You will notice too, I just want to point out that the dosing for Narcan is the same as the dosing for Ativan. Adults 2 milligrams intranasally initially, and in pediatrics you've got 0.1 milligrams per kg in 2 milligram increments. The only difference is the max dosing. I created this sheet for you. It will be placed in your procedure index, available to you on group sites. It'll be part of the training that you will be able to utilize on Target Solutions. And the top part of this just gives information we've already discussed: the drug, dosing for adults, pediatrics, concentrations, and the medications, the 3 medicines we will be using intranasally. Remember to deliver half of the dose, whatever that dose is, per nostril, to spread out your dosing and to maximize the possibility of absorption. Now, this is a fentanyl dosing chart for intranasal delivery at 2 micrograms per kg. In addition, it's adding the 0.1 milliliter dead space. And this has been created up to a 50 kilogram patient. I didn't go any further with the dosing. This would be the largest amount of volume you would be able to give intranasally, is 2 milliliters. So if you look, you'll see patient weight. Let's just use for instance, a 3 to 5 kilogram patient. And you'll see that the fentanyl dosing is 10 micrograms. And the fentanyl volume, including the dead space, in other words, the volume would be 0.2 milliliters, which is 10 micrograms, plus the 0.1 milliliter for dead space. The total amount to be administered would be 0.3 milliliters. If you did not pull up the extra 0.1 milliliters for the dead space, instead of delivering your dose of 0.2 milliliters or 10 micrograms, you'd be giving half of that, 0.1 milliliters, only 5 micrograms. So in the smaller patients, it makes a huge difference pulling up that extra dead space. Please be sure to do it in all patients up to a 50 kg patient. All right, so Remember to divide the dose. Deliver half in each nostril, up to 1 milliliter per nostril. If the patient weighs more than 50 kgs for fentanyl, then you would have to give the dosing in 2 doses, which is appropriate if you need to, but you have to wait at least 5 minutes before you give and titrate the second dose. Obviously, in that time, an IV could most likely be established for an IO, and at that point, you may not need to use your intranasal administration route anymore unless you choose to. So we're dividing our drug doses in half and then putting half in each nostril, which is doubling the absorptive space available. If there's something wrong with the nasal mucosa and it can't absorb medications effectively, you will not be able to use intranasal route. For instance, a bloody nose that's pouring blood, some type of congestion or seepage out of the nose that cannot be suctioned out, then that's going to prevent mucosal contact to the drug. Destruction of the mucosa from surgery or cocaine abuse. Snorting cocaine is a vasoconstrictor, so it may prevent absorption. However, that is a relative contraindication. Your MAD kit is going to be set up and organized and decided by operations, of course. Here are some things I know you're going to need in them and some suggestions here. You're going to need, obviously, the cones, the mucosal atomizer devices. You're going to need needleless syringes, 1 mLs and 3 mLs. And you're going to need blunt tip needles to remove the medication from a device when necessary. So utilize your blunt tips, and you're going to need 2 boxes of your Luer Lock refill Narcan. The Luer Lock can be removed and you can draw from the container itself, and that is something that you guys will also be going over with your training. The needles that are on the Narcan, I have not been able to find a safe way to remove those. If someone else does, give me a call, let me know, but I would just make sure you have the needleless when that's available. This is the protocol, pretty straightforward. You can use this device whenever IO-IV access hasn't been established, or when the intranasal route is chosen as the most optimal route for that patient. And here is your procedural index. If you guys have any questions, I want you to feel free to contact me. My phone number is 843-915-7070, and you can always reach me by email, jordansh@horrycounty.org. You could also contact medical training or your medical officer if you have any further questions. Thank you. Thanks for listening.